Hey, welcome back to the channel. Thanks for joining. So this isn't a car video. It's not even a watch video. This is one of my post-op surgery videos. 2 months ago, it's been 2 months now, I had spine surgery. So this is an update on that. If you recall, if you've seen my other videos, I had a spinal laminectomy and fusion from L2 through L5, and this was due to spinal stenosis. So yeah, it's been 2 months. Hard to believe. Time flies, although right after surgery, it seemed like it was really going slow. Time was going slow. It seems to be going very well, though. I still have some lower back stiffness and pain in my glutes and lower back and hips. And some days are better than other days. But other than that, it's again, seems to be going really well. I'm not taking any meds to speak of except Tylenol, but I don't even take that every day. Sometimes, I take it, I take maybe 2 tablets at the beginning of the day, and that's about it. And again, seems to be going really well, except for that, stiffness and pain in the lower back. I was hoping maybe that would start to wane by now, that pain. But maybe my expectations were just too high. I don't know. But, I seem to be walking really well. I'm walking about a mile a day. I'm either walking outside. It's getting cold here now. So if not outside, I walk on a treadmill for about a mile. And if I'm really feeling good and I'm outside, for example, I walk a little farther than that. I am working from home, which is good. And I don't have to drive into the city. It's still a little tough if I'm, in a car for a long, long period of time, but I am driving more now. I'm, going to the supermarket and so forth, and I can drive. I've driven 20 minutes. It's probably the longest I've driven at a time to go to my post-op surgical post-op appointment, and I'll tell you about that in a second. But other than that, sometimes at night, not sometimes, I think most nights, I wake up maybe an hour after I fall asleep, and I may have mentioned this in the last video, and I have a lot of sort of like, I don't know if I'd call it pain, it's like real tightness, like my calves want to rip out of my skin. I kind of had this before surgery, and I have to try to massage my calves. Sometimes I have to get up and stretch them, and sometimes it takes a while for that to go away, or maybe it doesn't go away, but I just eventually fall asleep. I do still have some gabapentin. Again, I'm really not taking anything except Tylenol, but I did try gabapentin a few times, and it seemed to work a couple times, but the last time I tried it didn't seem to do anything. So yeah, I don't know what it is exactly. I'll speak with the doctor next time I go for an appointment. And speaking of appointments, I had my 8-week post-op appointment a short while ago, and the first thing I did when I got there is I had some x-rays. And, maybe I'll show you this imaging now just to show you what it looks like, what the fusion looks like. And basically, as you can see, they have a couple of rods because the laminectomy is basically removing bone from the spine to open up the area, because stenosis is basically the narrowing of the spinal canal, and then it kind of pushes in on the spinal cord. So they have to cut away bone to open that up. And then, of course, because they're cutting bone away, it destabilizes the spine. So then they take steel rods and they screw them into the spine. So it's just weird to see these screws in the x-ray that are going into my spine. But in any event, the doctor said it looks really good. He said healing is going well. As I mentioned in the last video, I am using a bone growth stimulator. You can't really feel it when it's turned on. I use it about 8 hours a day, and I assume it's working. I also asked the doctor about the incision. He said it's healing really well. It's still red, but it's pretty much healed. He said it was a little swollen still, not greatly, because you can't really see that by looking in the mirror, but he did say it was a little swollen. Forgot to ask him if that was normal at this time. I assume it was, but that also means now, because it's healed, the incision for the most part, I don't have to worry about getting it wet. I mean, I haven't been anyway. He said I could get it wet from way back in the shower, but he said don't go in a bath and submerge yourself or anything like that. He said I'm clear to do that now. So again, he said the incision looks really good. He's lifted some restrictions, even though you, right after surgery, are not supposed to bend, twist, or lift anything more than 10 pounds. That has been lifted a little bit. He said now I can lift up to 20 pounds and I can sort of bend a little more and maybe twist a little more. I don't know what that means because I'm still kind of paranoid to do that. But in any event, that is, it feels better now if I'm not if I'm not really extending myself, which I don't kind of dare do. But I mean, I feel pretty good for the most part. Sitting down, there's really no pain. It's just, again, when I'm standing up too long or walking a little too far, that lower back stiffness and pain that kind of goes into the glutes and around to the hip, that does happen. But unlike before surgery, my legs don't disconnect. I don't have my legs kind of, getting wobbly and losing strength. They're still good. So I can basically stand up as long as I want. A little while ago, I was getting some numbness on the bottom of my right foot. It was off and on, but I don't really seem to be getting that now, which is a good sign. I asked the doctor if I could start to do more exercises and go to the gym, and he said yes. But again, you have to be really cautious with whatever you're doing. That doesn't mean you can go back and do what you were doing before. What I specifically discussed with him, and he said, yeah, that makes logical sense. So I was clear to do what I asked him about, and that was using machines. So for example, instead of doing the bench press on the bench, there's the sit down machine where you're sitting upright and you're pushing against, you basically this way when you're sitting down. So you're not putting any weight on the spine. It's not compressing the spine. And of course, I'm using way less weight than I did before surgery. But, and again, it's common sense. I'm using much less weight, but it feels good. It's really important to kind of feel your own body and make sure that what you're doing doesn't feel weird or feel like it's putting any strain or pressure or pain on your spine or any other parts of your body. So I'm good with that. I asked him about lat pull downs, and he said, yeah, as long as I'm not using weight that's not too heavy, because again, I'm kind of pulling down and it's kind of bringing me up because of the weight. It's not pushing down. I am doing some bicep on the preacher bench. And again, it's not really pushing pressure down on the spine. It's the preacher bench where I'm, doing the weights this way, and it is a machine. It's not the free weights. So I asked about that. He said I'm clear to use a recombinant bike, even though I used it once or twice, but I really am using the treadmill inside if it's too cold to walk outside. I asked him if I could sleep on my stomach yet. He said no, so can't do that. Also, the physical therapist had said, hey, once your incision is healed, you should kind of massage the incision or have, someone massage it for you to kind of break up the scar tissue. But I asked the doctor and he said no on that as well. So that's it. I mean, again, things seem to be going well. Still, still not perfect. Still have good days and bad days with that lower back pain and stiffness into the glutes and hip. I do have a follow-up appointment in 6 weeks, 6 weeks from the 8-week appointment, so another 6 weeks. Little surprised at that because I thought after the first appointment, it would be a few months before I had the next one. But no, he did make an appointment for 6 weeks. I hope that doesn't mean there were things that weren't as they should be. Again, should have asked him that. I don't know why I didn't. I guess other things were going through my head. But in any event, I will have another appointment in a few weeks, and we'll see how that goes. I'll try to remember to ask him questions when he makes a comment about something. But so far, so good. So that's it for now. If you have any questions or comments, again, because this video is to help other people that are about to or going through the same thing, please put the comments down below. Also, if you haven't already done so, like this video, subscribe to my channel, and hit the notification bell. Those things help a lot. Take care. We'll see you next time.